Hi everybody, I am Thatnursingprof and welcome to my channel. In today's video, we're going to be talking about the cardinal movements of labor. Sometimes called the mechanisms of labor, if you've heard it called that, they're the same thing. What this is the fetus, right, the baby, needs to navigate its way through the birth canal by doing a bunch of position changes, okay? So that's what I'm going to talk about here are those position changes. The first one is engagement. So this can happen during labor, while your patient is laboring, or during the last few weeks of pregnancy. This really kind of depends on what's going on with mom. Is this a first-time mom? Is this mom had multiple children in the past? That kind of thing. So some babies are already engaged before they even come to the hospital and are in labor. So what is engagement? This is when the biparietal diameter, which is the greatest transverse diameter in occiput presentation, so the head, and when we're talking about these, we're just going to be thinking about baby's head down because most babies are head down. So when that passes through the pelvic inlet, so this is roughly 0 station. And if you remember station, right, dilation, effacement, station, station is baby's presenting part in relationship to the ischial spines. So 0 station, baby's head, we're just going to say head for this example, is at the level of the ischial spines. When baby's head is above that, it's negative station, right? -1, -2. And then when baby's below, when we're ready to like labor down and push, we're +1, +2, etc. Okay? So engagement, baby's head is engaged with the pelvis roughly about 0 station. The sagittal suture, so this is our sagittal suture, right, like our mohawk suture, okay? The sagittal suture is aligned in the transverse diameter at this time. So this is what's happening during engagement. Now let's talk about the next one, descent. The second movement is descent, and that one's pretty easy to remember because it's exactly what it sounds like. So the head, or whatever the presenting part is moving downward into the pelvic inlet. So the downward movement of the head, we're just going to say the head for our example here, into the pelvic inlet. The sagittal suture, remember we talked about that one, the one in the middle. The sagittal suture will be from mom's symphysis pubis to her sacrum. And then, excuse my drawing here, not an art teacher, but we have our pelvis here. So this is mom's pelvis, and this is baby's head. This orange line here, that's going to be the sagittal suture. And this would be like our corneal and our fontanelles and all of that. But our sagittal suture, this one, is going to be like this. Okay, it's going to be from mom's symphysis pubis to her sacrum. In order for descent to occur, there's a couple of factors that happen. So pressure from the amniotic fluid, pressure of the fundus on the baby's head, or if they're breech on their bottom, contractions, of course, right, because that's helping move baby down, and then extension and straightening of the fetal body. All 4 of these come into play to help the fetus descend down into mom's pelvis. So now that we know about descent, let's move on to the next one. The third movement is called flexion, and this one's pretty simple. It's just simply baby bringing their chin to their chest. And they do that because their head has met some resistance. So that resistance could be from the cervix, the pelvic wall, or the pelvic floor. So that one's flexion, just bringing our chin to our chest. The next one, internal rotation. The next movement is internal rotation, and this is when baby is moving their head. So they have to rotate their head so that the long axis of baby's head will align with mom's long axis of her pelvis, okay? So this is my little drawing of that again. So here's mom's pelvis. If you remember before, the sagittal one, the orange one, was like this, right? It was more across. Now baby's rotated their head about 45 degrees, and now it's more like that. So that's internal rotation. The next movement is extension, and this is a huge one because this is the delivery of the baby's head. So the head is able to pivot beneath the symphysis pubis and be delivered. Why is that? Because babies tucked their chin to their chest and rotated already, and that's going to help the delivery of the head. what causes extension to happen? The force exerted by the uterus and the resistance from the pelvic floor. So these two together combine to make extension happen. So in the beginning phase of extension, baby's head has turned and it's more like this. Remember, with our internal rotation, it was kind of at an angle. Now we're a little bit more up and down. And then after it's complete, the head is delivered. Now you can see baby's little face, you can see their fontanelles, their sutures, their nose, their eyes, all that kind of stuff. The head is out. So we're getting there, right? So extension, the head is out. Now we got to get the rest of the body out. So that requires a little bit more rotating and delivering the shoulders. So let's talk about that. Getting the rest of the body out involves a little bit more rotating. So this next movement is the external rotation. And it's called that because the head is now out, right? The head is now external. It's also called restitution, if you've ever heard that word before used for this. It's the same thing. So what happens here is the head has to rotate back to its earlier position. So if you remember, with extension, the sagittal suture was like this, right, in relation to the pelvis. Prior to that, with internal rotation, it was at that 45-degree angle. So with external rotation, it needs to go back to that. Okay, so this is the part that's called restitution, where the sagittal suture is more at that angle like it was before. Then eventually, after it goes from this position, it needs to turn even further. So it's more like this, so the sagittal suture is lying across this way. This is going to cause the shoulders to rotate. So baby's body, which is still inside mom, is like stuck, okay? So if baby doesn't turn its head, then the shoulders can't get out. The shoulders need to come out this way because this is the widest part of mom. So in order to get the shoulders to turn, the baby needs to turn its head again. And at this point, the head is out. A lot of times the doctor or the midwife or who's ever delivering the baby can assist with this, can kind of help baby do a little turn to help get those shoulders out. So that is external rotation. Finally, last one, we have expulsion. The final movement is expulsion. So this is the rest of the baby is being delivered. So first they have to get the anterior shoulder out, then they got to deliver the posterior shoulder, and then the rest of the body kind of comes out a lot quicker after that. The shoulders are really the hard part. So once the shoulders are out, the rest of the baby comes out quite quickly. A little memory tool on how you can remember the order of the cardinal movements. Every darn fool in Egypt eats raw. So that's external rotation, so you can remember, because there's lots of E's here. So eats raw eggs. So that's the little memory tool you can use to memorize these, because you need to know them, and you need to know them in order, right? So how they work, what happens during each, and what is the order of all of them. So I hope you found this video helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.